Good day. This is Dr. Jana Price-Sharps from Mind Pilot. So today we're going to talk about a topic that people don't like to talk about, but it's a pretty important aspect of life for most people. We're going to talk about sex. So there's a lot of things that I could talk about when we're talking about sex, but here's a few highlights of things I want you to think about. If your sex life at home is not where you would like it to be, you need to ask yourself a couple of questions. First of all, is it because of your significant other? Is it because of you? What's going on? And then think about how much sex would you like? And this differs for people. I know people that they really just aren't interested in it. I know other people would like it 3 or 4 or 5 times a day. So where are you on that continuum? And as importantly, where is your significant other on that continuum? Because if you're a person that wants it 2-3 times a day on your days off and your significant other would be happy with once every 3 weeks, you got a problem. So how are you going to resolve that problem? Well, there's a number of ways of resolving that problem, but let's talk about what drives the sex urge. And people are like, well, that's pretty obvious, like, Jana, people want sex. Okay, but there are people that have sex to have intimacy, and there are people that have sex as a stress reliever. If you're that person that is using sex for stress relief, then you need to think about if you have a partner that maybe doesn't want sex as much as you do, then you're going to have to come to a happy medium, because your job is to reduce your own stress. And I know that's hard to hear for many people. I get this, but ultimately your partner is not responsible for reducing your stress. You're responsible for reducing your stress. So how are you reducing your stress? Maybe you've always used sex to reduce your stress, and now for whatever reason that's not as possible. What can you do instead? Yes, I understand there may be nothing in your life that feels as good as sex. I get that. But if you want to keep a happy relationship at home, you have to work together to come to some kind of agreement that works for both of you. It can't just be one-sided. So what can you do instead of sex to reduce your stress? And that's different for different people. Okay, some people have a lot of hot showers. I don't know what to tell you. But there's other people that may do athletic events. They may work out. They may go for a run. They may, watch exciting movies. They may play video games. They may do all kinds of things. Yes, it may not be as fun as sex, but at least it's a way to reduce stress. Now, I'm not saying video games always reduce stress, but sometimes maybe they do. Depends on who you talk to about that one. But I want you to think about how you approach the topic with your loved one. And this, again, you need to really think about what you think is flirting and what your significant other thinks is flirting. Here's what I hear a lot of, and so this may not be applicable to you. I understand that. I know this is a really sensitive topic, but some people are very playful when it comes to sex, and they kind of roughhouse, and they may slap each other on various parts of the body and that kind of thing, and they enjoy that. However, what happens when one person really likes to flirt that way and the other person feels like it's not appropriate or it doesn't make them feel good about that intimacy. For instance, let's say you're the kind of person that walks up and slaps somebody on the rear end, and that feels flirtatious for you. What if the other person is taking that as you're treating me like somebody who maybe is cheap? Okay, and I'm using that term because that's a term I've heard from spouses from time to time. And maybe that's never occurred to you. So a difficult but important conversation might be with your significant other is, what would you like? What would work for you? Not just what works for me, but what would work for you? When I flirt with you, is that working for you? How would you like me to flirt with you? How would you like me to talk about sex with you? How often would you like to have sex? And I know those are uncomfortable conversations for people, but truly, it works better than not talking about it and everybody being angry. So you take some time. You do it when it's a quiet time, when you don't have kids running around, obviously. And you ask your significant other, take the time to ask them and to have that, not a hard conversation, but just find out how they're feeling and then put a plan together that works for both of you. You may not get what you want, but you may get some of what you want, which is better than getting nothing of what you want. So then you need to figure out how you take care of yourself, because you're not going to necessarily get everything you want. But that intimacy is going to be really important. The statement that I'm about to make is not true for everybody, but it tends to be true. Where guys are much more physical and many women are much more, they want more touching and intimacy and that kind of thing. So you need to figure out what your spouse wants. It may not be what you think is fun and what you think is sexy. It may be something totally different. So figure it out, have those conversations, think about what works for both of you, and then do that. And if you're using sex for a stress reliever and your significant other isn't working for him or her, figure out something that you can do to relieve your own stress, because ultimately that's your responsibility. I know that's probably not what you want to hear, but it's the reality. And you're going to have a much better life than trying to force somebody to have sex with you that is unhappy about it. You want to end a marriage or a relationship? Keep doing that, and it'll be a disaster. And I don't want you to have a disaster. I want you to have a happy life. So you may have to do somewhere middle of the road. You can figure this out. You can do this. So I hope you have a wonderful evening. I hope you take care of yourself. You have the right to be happy. You have the right to set boundaries. And you have the right to wake up in the morning and feel good. I hope this helps. Weird kind of conversation, but I think it's an important one because it affects most people. Take care. This is Dr. Jana Price-Sharps from Mind Pilot.